Hey guys, welcome to the take two of this day with Dr. Deb Matthews. Something happened to our transmission and I hope you can hear me. She's hopefully going to join us soon. Today we're talking about her experience developing a practice that's a seven-figure practice, only working 7 days a month, not 7 days a week like we all do as physicians. We work like 7, 8, 9, 10 days in the 7-day week. But she's been doing that for some time now, and she teaches others how to do this. And we had her in our podcast, Design Your Physician Life, earlier this week, and please don't miss that. You won't want to miss her story. I'm hoping that she can join us any minute. We just had a little bit of technical difficulties, and we'll see if we can. Yes, I can hear you.
Oh, I don't.
Yeah, I know you were talking and you said tons of things, but and they were important things, but I couldn't hear anything.
Oh no. Oh well.
Sorry. So we're here in front of the water, and you're telling us about your experience. We were talking about how your mindset first changed and evolved from being a physician mindset where you have to work to like a more entrepreneur and having people really help you doing things and evolving to this point. So let's retake that there.
Okay. So yes. So all I knew was work, take call, charting and all of that stuff. And once my mindset shifted to think more like an entrepreneur, then I realized that even though I owned my practice, what I really owned was a job because I had to work, otherwise there's no money coming in. And if you really look at successful business owners, they're not the ones doing all the work. They're kind of the ones making the decision and running the show. And so I had to change my way of thinking. And my why behind why I wanted to even change my thinking in the first place, other than not wanting to have to work all the time, is because I had 4 kids. I have a husband, I have a dog. Like everybody wants my attention. I want to be there for my kids. I want to have, time and attention for my husband. And when I was working, I was so exhausted and overwhelmed and burned out. And, that I wasn't the best mom. I felt so guilty all the time for not having more time to spend with my kids. So I really wanted to be able to break free of the grind in order to live my life and be there for my family and still be able to be there for my patients. And one of the things actually that really helped me is I read a book called The E-Myth Physician. Have you read that?
Not yet. It's going to be on my list.
Yeah.
I have a long list. Like we all do have a long list of books to read.
I know. It's a fairly short book and it's a fairly easy read. And the idea is that if you own the practice, then you can't run the practice and be doing all the work because that's like 2 separate jobs. And if you can have other people that can do a lot of the things, that can free you up. And so once I sort of understood the gist of it, I started making baby steps in that direction. So I started to utilize like nurses and health coaches to do a lot of the explaining that I was doing. So I didn't have to spend so much time with all the explaining or with, helping me with charting things. And so a lot of the little things that were, things that a scribe could do or a, medical assistant could do, I made sure to get those off my plate. And I started hiring nurse practitioners to work with me and sort of transitioning stuff over to them. And that was really hard because I think that we think that the patients want me, I'm the one, it's my practice, they're here for me, they're not going to want to go see somebody else. And that's true for some of them. But once I started to hire really great people, they did a really great job. And over time, it got easier and easier for the patients to transition and to see them. And that really helped me a lot with my freedom.
Tell me a little bit about your systems because that requires a lot of moving parts and a lot of coordination. So you must have really good systems in your practice.
Yeah, we have worked really, really hard because if it's just you can do it your way. And you don't, or, if you have like one receptionist or, one medical assistant or something, you can sort of figure it out. But once your team starts to grow, then you really have to have systems so that everything can run like a well-oiled machine. So I spent about 1.5 years where my focus was on creating these systems, writing it down, getting everybody on the same page, really working on training my team, as opposed to working on marketing or, spending money on ads and all of those kinds of things. I ignored that and I really focused in on our systems and our processes. And during that time frame, things really, like the revenue really went up because everything was running more smoothly. We had so much less aggravations and, just all the things that slow us down and just irritate us. It was such time so well spent. And so now if we add new people to the team, we've got written out exactly how we do things. People can, cross train so easily and fill in for each other when somebody's out. So because I have these systems, now the team knows what to do. They don't have to come and ask me for every little thing. I can go off, on vacation or whatever, and everything just runs smoothly without me, which is so freeing. Isn't that what we all want?
That's the American dream, they say, right? So tell me about how many patients did you have already? Because you had a practice that wasn't running like that for like around 7 years, right?
Okay,
how many patients had you accrued during that period of time already? And then when you said, you know what, I'm going to stop and I'm going to focus on building systems.
Yeah. Okay. So I don't even know how many patients I had. I would say that in the early days, we would have an average of about 300 new patients per year. I wasn't keeping track of numbers, so I don't really know how many were active patients, how many had come and gone. But, if that adds up to, somewhere around about 2,000 patients and, some of them left, let's say maybe we had 1,000 patients. I don't know. We had a lot of patients, though, to the point where I was exhausted. I'm trying to see all the patients. My team isn't doing what I want them to do. No matter how many times I say, I need you to do this before the patient shows up or whatever, it would never happen. I used to complain to my mom, to my sister, to my husband, to everybody that my staff wouldn't do what I wanted them to do, but I didn't know how to make them do what I wanted them to do. And I was so overwhelmed with trying to see the patients and look after the patients. I didn't have time to make the staff do what I wanted them to do. And it was just, the whole thing was just so overwhelming and exhausting. And I started off, I loved my practice. I was so happy to be doing what I was doing. And I got to this place where I was exhausted. I was overwhelmed. I was aggravated. I felt trapped. I didn't know how to get out. I didn't want to work there anymore, but who's going to look after my patients? I'm so guilty that I don't have time with my friends and, my family. And I still wasn't profitable. Like couldn't pay myself a living wage. And I was ashamed. I was embarrassed by that. Like, I didn't want anybody to know that I'm working so hard for like nothing for so freaking many years. I mean, I felt really ashamed.
So fast forward now, 7 more years, and now you live a different life. So for a physician, to tell the physicians, to give them inspiration of what's possible.
Yes.
Let's discuss, tell us about how one work day looks like for you, one whole week and one whole month.
Okay.
How do those look for you?
Okay. So on days when I'm actively seeing patients in the practice, I see between 4 and 6 patients a day. And I have the time that I need to sit with them and talk to them. And then I have, my medical assistants, health coaches, nurses, etc., that I just have to say, okay, this patient needs this test or, whatever. And somebody else looks after it for me. And even in some of these appointments, the notes are done for me. So by the end of the day, and for me, I typically finish seeing patients by 3 p.m. I spend an hour or so, just whatever, returning calls, paperwork, whatever I need to do. 4:30, I'm in the car on the way home. That's a seeing a patient's day. In a typical week, I see patients about 2 days a week. Another couple of days I'm doing admin, which means that I am on something like this with you, which has nothing to do with admin, right?
This is fun. Come on, look at the water.
Oh, I know. But doing podcasts and things like that, which is fun. And, that helps with marketing for the practice, when it's a patient-facing thing. But I'm training my team. I'm we're working on if there's new systems that we need to develop or like next month. So we're planning that. So that's fun. It doesn't feel like work when I'm doing admin stuff. But 1 week a month, I'm out of the office. Like this past, like the last week of January, the first week of February, I was in Cabo with my husband. The second week of March, we're going skiing in Vail. in April, we're going to New York City, and then we're going to Cleveland to visit my son who's going to dental school there. So 1 week of the month, I'm off traveling and doing whatever. And actually last year I spent 14 weeks out of the country. I spent 8 weeks at different times in different parts of Mexico, 2 weeks in Spain, 2 weeks in Canada, 2 weeks in India. We stopped in the Maldives on the way home. And plus I went to all sorts of conferences all over the country. So lots and lots of time traveling. And when I'm gone, the revenue is just the same. Like, it doesn't dip because I'm out of the office. Nobody calls me. They're not calling me to say patient so-and-so is having this problem, or, what should I do? Or the toilet's plugged, or, whatever. If something happens, they just handle it. And what I was really surprised to find, because last year I've never spent that much time out of the office before. The more time I spend out of the office, the more our revenue went up. And the less the team needs me, because if I'm not there, they figured it out. And if I'm there, it's just easy. They just turn to me, right? But if I'm not there, they just figured it out. So they became even more independent. They like their job better because they have more autonomy and they can make decisions. And I'm so grateful that they're making decisions while I'm off in the Maldives, that, even if the decisions that they make aren't maybe the exact decisions that I would have made, who cares? I'm on the beach, they're doing a good job. I'm so grateful to have them. And that's another really big mindset shift. I used to feel like my employees were my biggest expense and the biggest source of aggravation, trying to manage them and, their drama. And that was like the part of my job that I liked the least. Now, I don't even feel like they're employees. I feel like they're my team. I feel like my team is my biggest asset. I am happy to pay them well so that I can go off and do what I want to do. The practice is growing, so I can afford to, I can afford to be traveling. I can afford to be paying them well. And the whole culture in the office is a completely different place. We don't have drama. Everybody is happy to be there. They work well together. They support each other. If one person is out, the other person steps in to take over, to fill in the gap, instead of feeling resentful that, now I have to do her job too. They know that when they're out, that person's going to fill in for them. So it's a completely different environment. It's such a nice place to work. It's night and day.
So let's honor your team right now. Who do you have in your team?
Well, I have practically people. They're fabulous. I just hired a third nurse practitioner. He literally started on Monday. Lured him way across the country to practice, because we really want the best people, right?
It's cutting off. Can you hear me?
Yeah, can you still hear me?
It's cutting off a little bit. I don't know if you can get a little bit closer to the microphone or something.
Can you hear me now?
Yes.
Okay. But I have a physician assistant who does our aesthetics. I have 4 health coaches, and then, all the support staff. So they're really awesome.
Awesome. Well, guys, thank you for helping Dr. Matthew, because she's helping, you like not only a team, I think it becomes really like a family more.
Yeah.
Long term, taking care of each other. That's awesome. So now you help physicians to really achieve this same dream. Tell us about that. How can people work with you so that they can work less in their practices and do more for their patients, do more for themselves, control a better experience for their employees? How can they reach you?
Yeah. Well, so I feel really passionately about this. I really want to help other physicians because I'm so grateful to be where I am. I could have never gotten here unless I had other mentors that had helped me. And I feel like I can help more patients if I'm helping the physicians, like I can only help so many people one-on-one. So what I've started to do is I have some different mentorship programs to help physicians. And the next one that I have coming up is a retreat in Acapulco, Mexico, where I want to help physicians to learn how to have a self-managing practice. So how to work, 7 to 10 days a month, be able to leave the practice and still the revenue comes in and your team isn't calling you, really how to grow an independent team that functions like they are part owners of the practice instead of just, there to pick up a paycheck, so that you can really enjoy your life, enjoy your practice. And if you're not kind of stuck in survival mode, you can help more patients too. You can do better for your family, for yourself, for your staff. It's sort of for your patients, it's a win-win for everybody. So the next retreat is going to be May the 8th to the 14th in Acapulco. And we're going to be talking about strategies in order for you to get to the place where you can work 10 days or less a month. You can leave the office, the revenue's there, so you'll have less stress and more profits.
And how can they reach the link? Where do they go to sign up for this retreat?
Yeah, so at the moment, what I would say is if you would just want to go to my website, it's drdebmd.com. And then there's a contact page. And if you just send me a message, I'll shoot you the information if you're interested in hearing more about it.
That's awesome. Guys, remember, #live, #replay if you want to listen to all this information again. And thank you for being with us. Any final tips for physicians who want to, live the dream, change their mindset, help, get help with that little shift that we need in our lives?
Yeah. I think the biggest thing is you have to believe that it is possible. And that's hard. Like, I remember when I first started working with some of the mentors that I've worked with, I'd listen to them talk about their practices, and it just sounded like this unattainable dream. But it is possible. And if you connect yourself with other practitioners who are successful, who are living the life that they want, that really matters. Whereas if you're just surrounded by all the other people like you who are just in the grind, who are, fed up with the medical system and whatever, then it's discouraging and you don't see the possibility. So surround yourself by the people that are doing what you want to do.
Well, thank you very much. Thanks for being here, and keep helping so many patients, your team, and so many physicians who really need to learn this way of practicing medicine. Thanks a lot.
Thank you. Bye.
Bye.